neurovascular bundle in the abdomen region. We are going to draw a diagram discussing the nerves and the arteries supplying the abdominal region, the various viscera. But first, let us have an overview. This is a side view of the developing baby, and we are comparing it with the adult. And we already have discussed that the abdominal aorta is going to give some branches to the various parts of the gut tube. Say, for example, this is the abdominal aorta, which is on the posterior abdominal wall. It is retroperitoneal, and it is giving us the celiac trunk to supply the foregut region. If it is the midgut region, we'll have the superior mesenteric artery, and for the hindgut region, we are having the inferior mesenteric artery. We should also know the boundary line between foregut, midgut. Foregut and midgut, if you are looking for the boundary line, you can see it is at the second part of the duodenum, where there is opening of hepatopancreatic duct. So, at the opening of hepatopancreatic duct, before that, the proximal half of duodenum belong to foregut and distal half of duodenum belong to the midgut. So, that is foregut midgut junction, and that will be a junction of the territory of celiac artery branches and superior mesenteric artery branches. There will be some anastomosis. Similarly, if you are talking about the midgut hindgut junction, right 2/3 of transverse colon is midgut. So, if you say right 2/3 of transverse colon is midgut, till that time midgut artery, that is superior mesenteric artery, will be supplying. But after that, if you look at the lateral 1/3 of the transverse colon and distal to that, that is the hindgut. In the hindgut, it will be the inferior mesenteric artery supplying. Of course, at the junction, there will be dual supply. Now, as we are talking about the nerve supply, if you remember, we have discussed earlier as well, till the midgut, it will be the vagus nerve. So, vagus nerve is taking care of the gut tube till the midgut, and beyond that, if we are talking about the hindgut, it will be taken care of by nervi erigantes. Now, this is parasympathetic system we are talking about, and parasympathetic system, what it does is it will cause bladder and bowel evacuation. How does it do bladder bowel evacuation? By increasing the peristalsis and relaxing the sphincter. If you increase the peristalsis, relax the sphincter, then whatever content is, it will go out. Fecal matter go out, defecation, urine goes out, urination. So, urination, defecation is under the parasympathetic system. Now, what about the sympathetic system? Sympathetic system, you have a sympathetic chain running, and through the sympathetic chain there will be some splanchnic nerves coming. If you are talking about the foregut, you will find for the foregut there will be greater splanchnic nerve with the 5 root values starting with 5, that is T5. So, thoracic 5 to 9, you will have the greater splanchnic nerve supplying the foregut. Then for the midgut, we will have the lesser splanchnic nerve, which is T10, 11, the next two root values. And if you are talking about the hindgut, there will be T12 least splanchnic nerve, but more specifically you can say lumbar splanchnic nerve, because they have lumbar root value mostly. So, T12 and L12, that will be the root value of the lumbar splanchnic nerve and taking care of the hindgut. Sympathetic system is for storage, and it is antagonizing the parasympathetic system. Now, all that information let us put in a table, in a diagram, and we will revise it and put some more details. Here we are looking from the front view now, and say this is the diaphragm. Diaphragm, in front of the T12 vertebra, there will be one opening, that is the aortic hiatus for the passage of aorta, and here the aorta will be passing. The aorta is abdominal aorta now, and this abdominal aorta will be running from T12 to L4 vertebra, because at the L4 vertebra it will be bifurcating into two branches, which are called as common iliac artery. Common iliac artery itself will divide into internal and external iliac artery, and external iliac artery will be passing under the inguinal ligament to continue as the femoral artery. So, as we are talking about the branches, you see here we are mentioning diaphragm. In front of T12 vertebra, there is aortic hiatus for the passage of abdominal aorta. Abdominal aorta extent is T12 to L4 vertebra. At L4, it will give two common iliac arteries. Common iliac arteries will divide into the internal and external iliac artery. External iliac artery, as it crosses the inguinal ligament, it will become femoral artery, and then this femoral artery is going to supply lower limb. But here we are not talking about lower limb, we are talking about the abdomen and pelvis also, you can say. It is the internal iliac artery which will be supplying the pelvic viscera, and the pelvic viscera, like you can name few of them. Urinary bladder, behind that you will have the uterus, and behind that you will have the rectum. So may it be urinary bladder or uterus or rectum, they will be supplied by branches of the internal iliac artery. External iliac artery goes become femoral artery for the lower limb. Now the same will happen on the other side also, internal iliac here and external iliac there. So this is the external iliac artery, that is the internal iliac artery, which is going to supply. See, these branches will be given for the pelvic viscera. What we are showing here is the pelvic viscera. Now before you start talking more details about the pelvic viscera, let us talk about the abdominal region also. At the level of L1 vertebra, that is also the transpyloric plane, L1 vertebra, where you have pylorus of stomach also, you will find that the abdominal aorta is giving one anterior branch. Abdominal aorta actually give three anterior branches for the foregut, midgut and hindgut, and the very first branch is coming at L1 vertebra, and that is what we call as celiac trunk. Celiac trunk is for the foregut. T12 level it will come, it is junction of T12 L1. Exactly, if you say transpyloric plane L1 vertebra, there you will have the superior mesenteric artery. So T12 it is passing, lower border of T12 it will give celiac trunk for the foregut, and at the transpyloric plane L1 lower border it will give the superior mesenteric artery. It is superior mesenteric artery which will be at the transpyloric plane L1 vertebra lower border, L1 vertebra lower border, and it will be the superior mesenteric artery which is supplying the midgut. Now you have to go a little bit lower and you say this is the inferior mesenteric artery which is going to supply the hindgut, and here we will put one boundary line also above the inferior mesenteric artery. Why would you put one boundary line above the inferior mesenteric artery? Because we have discussed about the parasympathetic system, the vagus nerve supply till this boundary line. So as we are mentioning vagus nerve is a parasympathetic nerve, and this parasympathetic nerve vagus can supply till the midgut level. If you go beyond that, here nervi erigantes will be taking care of the hindgut, and not only hindgut but also the pelvic viscera. Nervi erigantes are also called as pelvic splanchnic nerve. So they have root value S234 coming from the spinal cord S234. Now if you say nervi erigantes or pelvic splanchnic nerve with root value S234 are supplying the hindgut and also pelvic viscera, what do they do? We already have mentioned, may it be the vagus nerve supplying the foregut midgut, or may it be the nervi erigantes supplying the hindgut and pelvic viscera. They will be actually causing bladder and bowel evacuation, and how they do that is increasing peristalsis and relaxing the sphincter. Now on the other hand, the sympathetic system is for storage, and for sympathetic supply you can show it on the other side. Of course these things will be bilaterally present, but on one side we are showing parasympathetic, on other side we can show sympathetic. So what will be the sympathetic supply if you are talking about this region? Say in the sympathetic supply there is a sympathetic chain keep giving some splanchnic nerves, and you can talk about them. For the foregut, as you can see, this is the foregut. For the foregut you will find there is greater splanchnic nerve, and for the midgut there is lesser splanchnic nerve. Then there is a least splanchnic nerve also, but as you talk about hindgut, better say lumbar splanchnic nerve. So these are some of the splanchnic nerve, they are sympathetic nerve and they are for storage. How the sympathetic system do storage? By antagonizing the parasympathetic system, it will reduce the peristalsis and it will constrict the sphincter. So that is how it is working. Sympathetic storage. Now what is the root value of the greater splanchnic nerve? As you are talking about the root value of greater splanchnic nerve, it has 5 root values starting with 5, that is the T5, thoracic 5. So thoracic 5 to 9 it will be greater splanchnic nerve. Lesser splanchnic nerve is next, so T10, 11, it has 2 root values. Least splanchnic nerve is T12, and then you again have this repeat value with lumbar splanchnic nerve T12, and then it will also have L12. It is called lumbar, so it should have lumbar root values, but it also has T12. So T12 L12 is lumbar splanchnic nerve for the hindgut, and not only for hindgut, but will also take care of the pelvic viscera. As we have told, pelvic viscera, the parasympathetic supply is Nervaic enigentis, pelvic splanchnic nerve, whereas the lumbar splanchnic nerve, not only they supply hindgut, but they will also supply the pelvic viscera for sympathetic storage. Now here we have talked about the gut tube. What about the renal tube, genital tube? For renal tube, you will have renal arteries, but they are not anterior branches, they are lateral branches. And for gonads like testis, ovary, you have anterolateral branches. So you can show here that when we are talking about the renal arteries, they are lateral branches. Like this, you can show the kidneys here, left kidney, the right kidney, and these are the renal arteries, and they are lateral branches. If you are looking below that, inferolateral branches, they are gonadal arteries. Gonadal arteries, anterolateral branches, and that could be testicular artery or ovarian artery. Testicular ovarian artery, they come directly from the abdominal aorta, anterolateral branches. These directions are important because they will be followed by the lymphatics. Now, as you can see, kidney, who will supply kidney? Kidney will be obviously supplied by the least splanchnic nerve, and even the gonads can be supplied by least splanchnic nerve. But the thing is, you can remember one thing here. You remember one value T12, and then you can say plus minus 2. Now, when you say T12 plus minus 2, it means that you have to include T12 root value, but plus minus 2 means you can go 2 values before that. That means it is T10 and T11, and you can go 2 values after that. That means L1 and L2. So, total 5 values. You have to understand what I am telling you is kind of a trick. Remember T12 plus minus 2, and this T12 plus minus 2 means you can go 2 values before and 2 values after. Total it will be 5 root values T10, 11, 12, L12. Now T10, 11, 12, L12 is the 5 root values for 5 organs. And what are the 5 organs? This root value will be, it is supplying the kidney, the gonads. This could be testis, ovary. It is supplying the urinary bladder, uterus, and rectum also. So remember the 5 root values for the 5 organs. And what are the 5 organs? Kidney, testis, ovary, the urinary bladder, uterus, and rectum. So the point is, say urinary bladder. Urinary bladder is a little bit lower, so it will have T12. Everybody will have T12, but if it is a lower viscera, you will have T12 L12. So for uterus, you can choose T12 L12, but if it is kidney, you prefer the previous one, means T10, 11, 12. Though all of them have 5 root values, but they have a preference, higher value for higher organ and lower value for lower organ. But you remember, kidney was a pelvic viscera and it has ascended up into the abdomen. In fact, kidney will have all the 5 root values. So just remember, that will help you in answering some of the MCQs. But uterus, you can definitely remember that the uterus will definitely have 5 root values, but more so T12, L12. Now, why do you want to know that? I want to know about that because when I am doing cesarean section, say I want to deliver a baby, I want to do cesarean section, I will do lumbar puncture, or if I want painless vaginal delivery, then I will do epidural anesthesia. My focus will be chiefly on T12, L12. But if I am doing this vaginal delivery and say for example, you are doing episiotomy. Episiotomy is when the baby's head is being delivered through the vagina, you are cutting the vaginal wall. That time you will have to block the nerve which is quite lower. Understand here one thing, you will have a pelvic pain line. Say here we are looking at the pelvic pain line. This is pelvic pain line. It is decided by covering of the peritoneum. Let us take example of uterus only. Say this is the uterus and this is the cervix, and this is below that is the vagina here. So as you will notice that before that the uterus itself is covered by peritoneum, and below that level, like vagina, is not covered by peritoneum. So there are subperitoneal structures. There are peritoneal structures, there are subperitoneal structures, that is pelvic pain line. Now when you say this is the pelvic pain line and it is deciding that uterus above that line is covered by peritoneum and the vagina below that is subperitoneal, not covered by peritoneum, the pain carried by these viscera is different. The pain which is above this line will be carried by lumbar splanchnic nerve, that we have told T12, L1, 2, and pain below this line will be carried by nervi irrigantes, which is S2, 3, 4. So this pelvic pain line is important because it will tell us a boundary line. Above that, the pain is carried by sympathetic system, lumbar splanchnic nerve. Say when uterus is contracting, labor pain, where the labor pain is felt, it will be referred pain, referred to T12, L12. Now where is T12? It is loin, and where is L12? Anterior middle thigh, groin. So loin to groin pain. This loin to groin pain is the first stage of labor where uterine contraction is going on. So T12 is loin, renal angle basically. Even kidney pain is like that. Kidney pain is from loin to groin. What is the root value of kidney? Same as the uterus, T12, L12. So loin to groin is the renal colic, and that is also the labor pain. Referred pain, these pains are felt less in the viscera and more on the skin, the dermatome. So T12, L12 if it is covered by peritoneum. If it is not covered by peritoneum, then it is S234. So where is S234? You know, in the perineum you have openings. Say it is female perineum, you have openings like urine comes out of urethra. This is vagina, this is anal canal. So if it is the opening of urethra, if it is the opening of vagina, if it is the opening of anal canal, that is the dermatome S234. Openings in the perineum is the S234. Perineum has this dermatome S234. That means when the baby was passing through the vagina, stage 2, labor, stage 2, when baby is passing through vagina, that time where the pain is felt. Now the pain is felt at the opening of urethra, vagina and anal canal. So that is referred pain. And what if I want to kill that pain? Then you have to kill the nervi irrigantes. The root value is S234. If you are just working at the end, that is episiotomy, vaginal wall, then of course pudendal nerve. And pudendal nerve also, it's a somatic nerve now, it also has the same root value S234, shares the root value of nervi irrigantes. Whatever nervi irrigantes has a root value, same root value is with pudendal nerve. Pudendal nerve is the nerve of perineum. It supplies the perineum, it supplies those openings. If you are working on those openings, then you have to block the pudendal nerve. But pudendal nerve also has the same root value. It's a somatic nerve, but having same root value as autonomic nerve, which is nervi irrigantes. So you can give pudendal block and do episiotomy. Root value is S234 only. So this is some basic idea which we wanted to have here in the abdomen region, neurovascular bundle.